Ureteral trauma. So this is a very short topic and I will focus my discussion over here to the various MCQs that are asked. So the most common cause is your iatrogenic cause, which is during the surgery near the ureter. Now, which is the most common iatrogenic cause? It is your hysterectomy followed by your ureteroscopy. Now, what are your various sites of injury? So here we have correlated your various site of injuries with your various steps. So at pelvic brim, it occurs during your ligation of your infundibulopelvic ligament. At the bifurcation of your common iliac artery, it occurs while the ligation of your internal iliac artery, and at the paracervical region it occurs because of the clamping or dividing of your upper vagina. Now, what are your methods for repairing a damaged ureter? Now, if there is no loss of length, then you would go for a speculation and end-to-end anastomosis without tension. Now, if there is a little loss of length, then you would need to mobilize the kidney, go for a Schwarz-Hitch of the bladder and a Boiry operation. Now, if there is a marked loss of length, then you would need to do a transureteral uterostomy, interposition of an isolated bowel loop or a mobilized appendix, and in some situations you might actually end up doing a nephrectomy. Now, a few images that have been taken from a Bailey and Love demonstrating your various operative procedures. So, if you look at this, this is for a technique of your upper ureteric injury. Your step 1 involves your ureteral mobilization, taking care to preserve your periureteral advential tissue, right? Then you excise the unhealthy ends and speculate the fresh ends on opposite sides and place a double J stent, right? A double J stent, and then you approximate it with your absorbable sutures without any tension. So this is usually for your upper ureteric injury. And then we have another image for you, which is for your body flap creation. So you can see over here there is a U-shaped flap creation, and then the apex of the bladder flap is sutured to the end of the ureter, and a double J stent is placed, and then we suture the bladder incision with your continuous and interrupted absorbable sutures. Right, so this is the Boiry flap creation, which is used for your ureteral injury when there is a little loss of length. So this can come as a one-liner MCQ to you also. Boiry flap is used in. So this were your few important points with respect to your ureteral trauma. Thank you.